Hi everybody, I'm Amy from Body Fit by Amy, and today I'm going to talk to you about TA breathing, or transverse abdominis, or belly breathing, and how to do a Kegel properly. So these are two things that are very important during pregnancy and as well in our postpartum recovery. So our transverse abdominis is our deepest layer of muscles. So we hear a lot, it's hard to tell since I'm 6 months pregnant, we hear a lot about our six-pack muscles, our rectus abdominis on the outside. Sometimes we call those the superficial muscles. But our TA, our transverse abdominis, is our deepest layer underneath all of that, and it wraps sort of around our torso. That is the thing that's most important to activate really in all of our core work, whether you're pregnant or not, but especially during pregnancy to keep your core strong for delivery and in our postnatal recovery to get that strength back after our belly has been stretching and moving. So we're going to talk about how to activate that with breathing. So we talk about it in a lot of my other videos, especially in postnatal videos, as a pelvic tilt. So thinking about tilting your hips towards your ribs. That sometimes that visualization doesn't work as well when you're pregnant, but it actually is a little easier to activate and feel these muscles working when you're pregnant. So what you want to do, you want to make sure it's a time when you're focused, and you just want to take a deep breath. As you inhale, think about expanding through the ribs and the lungs, not pushing out, but big inhale. And then as you exhale, think about pulling your baby in, up, and around. So I'm going here, inhale, exhale, everything's coming in and up. So I'm not squeezing tightly, I'm not sucking in, I'm activating that deepest layer as if I'm pulling my baby towards me. So it's a little hard to visualize, but something that helps is you can also put your hands on the side of your belly or cross them here and imagine that you're pulling your ab muscles together. So here, big inhale. Expand through the ribs, through the sides, exhale. In, up, and around, hugging your baby towards you. I'll show you one more time from the side because you can actually see my belly getting smaller. So inhale, exhale. So it's not a big suck in or moving through the shoulders, we're keeping it all in that deepest layer. It takes a little practice, and sometimes it's hard to find time to do it. So I like to do it maybe before I start a workout, or right before or right after I get in the shower, or sometimes if I'm just, standing in line at the grocery store, or I have a couple minutes while my son is playing. Whenever you can find time throughout the day to do that, it's going to be so great for keeping those muscles strong during pregnancy. Second thing we're going to talk about is how to do a proper Kegel. So Kegel or Kegels, people say it differently. You probably know a lot about this if you're a female. Usually the way we describe it is to squeeze as if you're trying to stop the flow of urine. That's sometimes the easiest way to describe it, but it's not exactly accurate because sometimes we end up clenching really tightly, maybe squeezing through our glutes. We want to think of a gentle, light connection. So your pelvic floor muscles, what we're trying to activate, run from the front of your pubic bone to your tailbone, so they're right there on the bottom. And if you just think about gently pulling them together, it often works with the belly breathing because you can do it on the exhale. And think again about pulling up and in, as if you're trying to pull something in through those pelvic floor muscles. But it's a light, gentle connection. Try not to squeeze really tightly because we don't want to get the glutes or the other muscles in the hips involved. So when you're doing that belly breathing at the end, you can think about adding that Kegel. And of course, we talk about Kegels a lot. Again, something you can do throughout your day while you're sitting at a stoplight or before you go to sleep at night. Really good for helping with delivery, keeping everything strong, and then again, helping with your postpartum recovery. So I hope that gives you a little bit of insight. Please feel free to ask me questions below. TA breathing and Kegels, your most important core exercises during and after pregnancy.